Hi, my name is Siavash Shariatzadeh. It's a pleasure to present our recent work on the role of mechanical force in intestinal growth entitled Mechanosensitive Adaptation and Regeneration of the Intestinal Muscle Layers in a Partial Obstruction Murine Model. This work has conducted under supervision of Dr. James Dunn. Intestine is a multi-layered complex tissue with stereotypical biophysical properties. The specific biophysical properties of each layer in the intestinal wall enable adaptations in mechanoreceptors to detect a wide range of intrinsic and extrinsic mechanical forces within each layer. In the recent 2 years, few publications have suggested the importance of mechanosignaling interactions within the longitudinal and circular muscle layers for normal intestinal development during embryonic ages. Our research has demonstrated the successful intestinal growth in response to longitudinal mechanical force induced by a spring in a model called a spring-mediated distraction enterogenesis as a possible practical treatment choice for children with short bowel syndrome. In the current study, we are aiming to characterize the role of radial mechanical force in intestinal regeneration. We utilize a partial obstruction model in mice to provide a non-dissipative radial force exerted into the lumen due to digestive accumulation over time. As our method, we placed 5 mm rubber tubes around the terminal ileum of wild-type mice and euthanized animals after 1 to 7 days. The dilated ileum proximal to the tube was harvested and compared to the normal bowel of untreated mice. The thickness of submucosa, circular, and longitudinal muscle was measured, and the histological alteration of each layer over time was graphed. The proliferation rate of each layer was analyzed using immunofluorescence staining for Ki67. The size and number of cells were measured as well. As the result, we observed an increase in the lumen radius over time, representative of intestinal dilation. The whole muscle thickness gradually increased after an initial decrease on post-op day 3. This demonstrated the maximal exerted strain in these layers due to dilation, as the lumen radius was increased by 80% after 3 days. The maximal decrease in thickness was observed in the longitudinal muscle layer among all the layers. A 25% decrease in this layer's thickness was observed after 2 days compared to the normal tissue. The decreasing rate in the longitudinal muscle was 2 times larger than the maximal decrease in circular muscle thickness. Additionally, we observed a significant increase in proliferation of epithelial and muscularis layers. And interestingly, the longitudinal layer showed a significant 3 times larger increase in proliferation compared to the circular layer after 4 days. We also detected that the number and size of cells in muscle layers increase over time, which indicates hyperplastic and hypertrophic adaptation, although data is not shown here. In conclusion, these findings suggest that the major mechanosensation may occur in the muscle layer, and mechanosensitive cells within these layers may relay growth signals within the lumen. We hypothesize that the longitudinal layer may be more mechanosensitive to the radial force, while the circular layer may have more mechanosensation in response to the longitudinal force. We have previously demonstrated some underlying mechanisms of intestinal lengthening in response to longitudinal mechanical force by using a spring-mediated distraction enterogenesis. The current study can bring insight into the biophysical characteristic of each layer of the intestinal wall and their role in normal gut development. This can have implications for understanding and treating intestinal disorders. In future, we aim to map the unprecedented signature cells and hit signaling pathways for intestinal development in response to the longitudinal and radially mechanical stimuli within each layer by single-cell RNA sequencing and spatial analysis. Thank you for your time, and please feel free to share your insights and feedback with us as we work toward refining our research.